Hello again. Thank you so much. Thank you so much again for your participation, and thank you for filling in the poll. We're just curious about who we attended this event, since in the North Hemisphere we are actually entering autumn. So the worries about the flu vaccination period will be more from the pharmacists and the practitioners working on the North Hemisphere. What we can see is that something it's worldwide. So practitioners worldwide are worried, despite they're not actually facing the challenges of having the flu vaccination period really close by. So again, thank you so much for your participation. My name is Luis Lorenzo, and I'm here as the moderator of this webinar. And then I'm currently the professional secretary of the International Pharmaceutical Federation. I'm myself a community pharmacist, a practitioner. I'm based in Lisbon, Portugal, but I have the privilege and honor to running some events, some international events on FIP. And I hope I can actually make the most of the presence of our excellent panelists that we have today to focus on this topic. So you can see here all the speakers that we'll have for this session, focusing on confidence, complacency, and convenience, key elements of flu vaccination strategies in time of COVID-19. So our webinar will be run for 1 hour and a half. You will have time to put your questions on the Q&A box. You will have two boxes, the chat box and the Q&A box. The chat box, you can use it for something else aside questions. But if you want to put some questions to the speakers, just please use the Q&A box. I would like to make some announcements regarding the logistics. First and foremost, you will receive at the end of this webinar, not actually at the end, but a few hours later, maximum 1 or 2 days, a certificate of participants. So you will have a certificate of attendance of this webinar, just so you can relax and enjoy the webinar. And then this webinar is being recorded and live streamed on YouTube as well on the FIP website. You can actually access it later on if you need it. You can also see the recordings on our fip.org site. If you are a member, you can actually have access to this membership area. And then again, you can put your questions using the Q&A box provided. Please let us know if you have anything to suggest for FIP regarding topics that you can actually have discussed in future webinars, or is something that you would like to have clarified on this one or on an extra one. Just feel free to let us know. We want to know what our members want to have discussed on our events. And again, if you're not yet a member of FIP, we kindly invite you just to go through the membership area on our website to know all the advantages and what you can gain by becoming a member of the Federation. I would like to thank IFPMA, the International Federation of Pharmaceutical Manufacturers and Associations, for teaming up with FIP on this topic. It's paramount, as we'll see later on, that we have one of the speakers who's actually coming from a background related with the Federation, and that's something that we have all learned through the pandemic, that together we are stronger. So it's really good to team up with really interesting, well, not only interesting, but professional and scientific-based organizations worldwide as IFPMA to run our events. So we have a couple of resources that will be discussed later on during the presentations. Just a short overview here, a guidance, and then an article that was published on the topic of today's webinar. And on the next slide, you'll see some infographic that will be discussed in detail in the presentation, as I mentioned before. And then here are the learning objectives of the session. And I would just like to address a couple of words just to make an introduction to the webinar. As you know, humanity has lived unprecedented times over the last 1.5 years. There are several areas which have been impacted by the pandemic, but one is specifically important now when the North Hemisphere is entering autumn and flu vaccination period is just around the corner. In 2020, the flu vaccination was historically mild, and there is a fear that the population is no longer aware of the negative impact of the infection. Furthermore, since the COVID vaccination schemes are still rolling, how will the logistics of flu vaccine be incorporated? In order to clarify this and other topics related to the 2021 influenza vaccination period and the strategies to make it successful, today we have with us a group of qualified panelists to help us understand this topic. And with no further ado, we move forward to the next slide. Well, just have an overview of our speakers again and the topics of their presentations. And now I would like to introduce our first speaker, Lynn Morgan. She's a coordinator, policy and communications group, the influenza vaccine supplier of the International Federation of Pharmaceutical Association Manufacturers. Lynn, she has worked for 8 years in public affairs, which has driven the company's policies on endemic disease vaccinations with global health stakeholders. Lynn was also the Sanofi Pasteur focal point for IFPMA for 4 years, including 2 years as chair of the Vaccines Committee. Her focus is now improvement of influenza policy and implementation. Lynn, thank you so much for your attendance. The floor is yours.
Louise, thank you very much. Thank you very much for that introduction. I'm very happy to be here. Thank you very much to FIP for the invitation. As Louise said, I'm here on behalf of IFPMA. So I guess many of you know IFPMA already. Basically, it's the research-based pharmaceutical companies trade association that links together global health across regional and national associations. They really, work from a Geneva basis to achieve sustainable policies and initiatives that foster innovation, create resilient regulatory systems, and uphold ethical practices. So within that large association, there's like a subdivision which focuses on influenza. It's called IVS, and it's the Influenza Vaccine Suppliers Group. And within that suppliers group, there are different areas of focus. There are technical areas that liaise frequently with the WHO on topics around, for example, flu pandemic preparedness, which is a huge topic that's gained even more focus in light of the current COVID pandemic. Areas such as following the strain evolution so that we're all better prepared with respect to the strain selection as manufacturers gear up to be able to provide Northern Hemisphere or Southern Hemisphere strains. And then there's another group which is around, which focuses on policy practice and communications. And I have a role of coordinator within that group. In full disclosure, as Louise mentioned, I work, my full-time job is with Sanofi Pasteur, so the vaccines business unit. And we, I head up the COVID and flu public affairs group within the head office, which is based in Lyon. So very happy to be here. Let's dive into what we're going to talk about today. So on the next slide, 2 key topics really. Why the upcoming influenza season deserves special attention, and what policymakers and health professionals like yourselves can do to protect the most vulnerable within that. So the basis of this intervention is really around a piece of work that IVS asked the Health Policy Partnerships Group to develop. And we asked them to work on this as we headed into the Northern Hemisphere season for 21-22. Based on what we were seeing in the environment. So of course, the situation is dynamic. This report was pulled up at the end of summer, so there have been some changes, but we thought that there were lessons to be learned from not only last year's Northern Hemisphere season, but also from the Southern Hemisphere season that had been drawing to a close. So basically, HPP conducted some desk research. They also talked with Ilaria Tsarani of the Pharmaceutical Group of the European Union on her perception of implementation of the flu vaccine programme. And they delivered this report along with a neat infographic that you can see here and a blog. So let's dive into their findings. Basically, we have a plethora of information around COVID. It's perfectly normal. We're in the midst of the pandemic. We all understand, or most people understand, the criticality of vaccination to protect people, our healthcare systems, and effectively our own lifestyles as well. So it's clear why COVID is a concern, but perhaps influenza being a concern is less evident. If we think about what we retained from flu last year, well, I guess most of us think it's gone. We don't really know anybody that had flu. And indeed, if you think about some of the figures that have been published by countries, there have been very few flu cases. The US CDC published that last year they had in the States 2,000 cases of flu reported, and in the previous season, the comparison being that they had 35 million cases of flu. So the contrast is quite massive. So why are we concerned? Well, this is why. And this is what we were seeing earlier on this year. The experts were coming out and saying, be very careful. We have low population immunity due to low circulation. And because of all the barrier measures that everybody's had to put into place, the social distancing, the masking, the disinfectants, nobody's been ill unless they've unfortunately gotten COVID. That, coupled with the unpredictability of the flu virus, means that we have to be very careful. So there's some quotes there from the US and UK experts saying, well, on one hand, be careful of twindemic, but on the other hand, just be careful about this these low levels of immunity that are being seen. So to be fair, I mean, governments seem to have been paying heed to these warnings, and certainly from a manufacturer's perspective, we are seeing we saw government demand being high for vaccine orders. And just to put this into perspective, when governments and purchases of vaccine for the Northern Hemisphere, they would place their orders back in, I don't know, February, March, April time, in order to allow manufacturers to have the right scale and delivery of volume when it comes to delivering for the actual Northern Hemisphere vaccine volumes. So basically, this isn't about purchasing. This is making sure that the vaccines in which countries and entities have invested in actually get into people's arms. And even in the last few days, I saw that the US CDC, so the head, Rochelle Walensky, is urging Americans to get shots for both COVID and flu, saying that vaccinations are not just important for ending the pandemic, but also preventing other infectious diseases, so namely flu. And an increase in flu infections this winter could put an additional burden on the nation's healthcare system, increasing stress on healthcare workers who are already fighting a large number of hospitalizations due to COVID. And also the former head of FDA, Scott Gottlieb, he chimed in saying that the flu season could be a whopper this year or next. So I think we have to be careful about scaremongering, but clearly the experts have expressed themselves. So on the next slide, yeah, thanks. So experts are one thing, and people are another. And frankly, many people are quite tired of hearing about vaccination, controls, certification, apps, QR codes, vaccine passes. I live in France, and before you can do anything, you have to show your pass on your phone, which I absolutely understand. But the point is, there's an element of people having had enough, and vaccine fatigue or complacency can set in, and I'm sure we'll hear more about that in the following intervention. And this is actually coming back to a concrete example that we saw in Australia, which is shown in the box here, where this country has a very robust campaign, usually very high levels of coverage. It's one of kind of like I'd say the benchmark countries in terms of ability to protect elderly people and vulnerable people, healthcare workers. And this year we saw that rates were really very low. And I think that the Australian government extended the vaccination season and sort of did some communication towards the end. But nonetheless, we had a lower coverage rate than what would normally be achieved in that country. And so this really confirmed the need to socialize the issue, to start talking about the risk of complacency, and underline the importance of HPP's analysis. And we weren't the only ones that were that were active on that topic. There were other publications around the same time. So if we have a look at the next slide. Just this is a reminder on the priority risk groups that do need to be protected above all. There are 5, and this is in line with what we see in the WHO recommendations. That position paper actually dates from 2012 and is in the process, out of interest, of being updated. There was a SAGE, so the WHO's NITAG, or Technical Advisory Group, met last week, and they were talking about updating the position paper. Right now, the WHO's #1 priority for flu is pregnant women, although healthcare workers during the pandemic have also been flagged as a priority. And it's not sure as we move forward if that same ranking of priority populations will be maintained. What is sure is that the categories that you see listed here remain the priority ones for vaccination. And the report came out with 4 key recommendations, and that's what we're going to walk through now. So the first recommendation is around convenient and safe access to vaccines by supporting flu vaccination in community settings. So enable convenient access. And we have seen huge groundswell for pharmacy-based immunization, if I can say thanks to COVID or in the wake of COVID, because of COVID. And we know that delivery of flu vaccine in the community settings makes vaccination convenient and almost certainly increases uptake. And that was one of the findings in a very nice benchmark study that Castellanos et al. Published in January of this year that got a bit lost in a lot of the publications that have come out around vaccination, that shows the success factors associated with 4 benchmark countries with very high vaccine coverage rates. And I'm sure I'm preaching to the converted here, but community pharmacists play a key role. Pharmacists are certainly amongst the most trusted source of health information in Europe. And so you do have a precious role to play in raising awareness, including amongst those risk groups, as well as immunizing. And HPP also talked about opportunistic flu vaccinations, so meaning combining routine primary care visits with pre-appointment text messaging or pre-reservation that would incite people to think whilst they're seeing their primary care provider to go ahead and get a flu shot. And I'm assuming that would actually save some money as well in terms of health systems. The second key message is really around the use of reimbursement to improve uptake. So in many countries around the world, like France, the UK, Italy, Chile, Australia, seasonal flu vaccination is fully reimbursed or covered for at-risk groups. And HPP really points to the evidence linking reimbursement on positive vaccine uptake, which is perhaps not surprising. The report actually goes further to evoke that it may be appropriate to expand reimbursement for flu vaccines more widely as a way of supporting the continued functioning of key services. And we did see that some of that during the previous Northern Hemisphere. They pick out the example of Scotland, where teachers and prison officers and 50 to 64-year-olds were also reimbursed to protect themselves, and as a method of reducing transmission and broadening that protection. The third key message was around the timing of vaccination. So this is a particularly interesting one for consideration right now, where there's a lot of movement on vaccination timing. So first off, if we step away just from COVID for a minute, if only we could, but if we just consider flu vaccination, already there's an important question around the timing of flu vaccination. Because if you think about the peak of the flu season epidemic, which tends to be in the US and Europe in a case in February, and you combine that with what we do know does happen, and that's the waning of immunity, particularly in more elderly people where we see immunosenescence. And so we do see that waning off, and it can actually be as much as 10% reduction in immunity per month. So that means there's a kind of a sweet spot to hit in when you actually vaccinate people, particularly those at-risk groups. And so there really is a call for optimization of vaccination timing to result in maximum protection. And we do know that some countries start vaccinating as early as August, early September, and that probably is too early. You need to be looking at October to have some kind of better duration of protection to be well equipped when the peak of that epidemic hits. And also to keep on vaccinating, so not to have that one peak and then sort of drop off, to keep up that vaccination so that the coverage rates are achieved, and encourage people to come, if they can't come at a particular time for whatever reason, to come back, even a few weeks later and make sure that they're covered. So if you then add COVID into the equation, we all know that there are recommendations that are very country dependent. The two vaccines are to be given separately in many countries with varying intervals, 14 days, 7 days. And they can also be given concomitantly in certain countries. So some major countries came out a while ago. I think the US was the first one saying yes, concomitant. The UK followed suit, France as well. I think Germany has now as well. But on the basis of fairly few data, we know that there was some helpful supportive data that came out of the UK maybe about 10 years ago in a study called ComFlu-Cov, if I've got that the right way around. I think it was ComFlu-Cov. And so that gave some support for administration with several flu vaccines, so particularly from a safety perspective. And then we heard about concomitant advances being made with, again, the SAGE last week, where they concluded that it was acceptable to have concomitant administration. So we'll see how that changes the remaining countries that have separate administration schedules, and they may well change their recommendations in the weeks to come. But then I'm not always sure, and it's not overly clear when we talk with different groups about how this ability to co-administer will actually help country programs, because it may well be that those doses of COVID that are still being given either as a part of a primary series, or as we're now looking to third doses as a continuation of that primary series for immunocompromised people, or even potentially booster doses when countries are going down that pathway, may well not be happening in the same place. So you could have COVID being given in a vaccination centre, but not at the same time as flu. So that still means, obviously, community pharmacists are playing a key role in ensuring that flu vaccination occurs. It's not sure either how many pharmacies are willing to give COVID and flu at the same time, with the logistical constraints that go alongside that. So it remains complex. And that's a direct link to the fourth message, really, and the last message from the report. And this is about the importance of working with community groups through targeted campaigns with very clear messaging on how, where, when. And if we come back to what happened, one of the analyses that came out of the Southern Hemisphere in Australia, it was clearly flagged that confusion and lack of clarity around the messages about what to get vaccinated, when, where, really fed into the fact that people just didn't go along and get vaccinated. There was confusion. The effect was definitely not good. People switched off. They put it off, and that meant, often they didn't go back and get themselves protected. So really this point is around reaching the most vulnerable with the right messaging, and that's critical for a successful campaign. And it's not, a one size fits all. Think about the different channels that people are going to tune into in order to go and get their vaccination. So in summary from this report, this is what we can take away. The upcoming season against flu, the whole winter pressure discussion that happens in Northern Hemisphere countries deserves special attention because of this low population immunity associated with the phenomenon of complacency and the overall kind of COVID fatigue. And that health policymakers, health service planners, health professionals like yourself need to be aware of this and act to protect the most vulnerable through the means that you have it available. And then I just have one more slide, and it's a blatant plug actually for a Together Against Flu platform, and this is housed within the IFPMA, and it was actually, FIP was part of its inception back, I think it was January 2020 or February 2020, although we kind of lost a year along the way with COVID. But the idea was to say, there's a lot of groups out there that have a lot of knowledge about flu use, policy, and let's connect all that together and put it in one single place. So this platform has been launched. I'd encourage you to go and have a look at it. There are some useful resources on there. And the partners that are part of it, that include FIT, that includes the International Federation of Aging. The idea is to feed it and keep it active and make it really a go-to place where you've got questions about flu policy. So I'd encourage you to go and have a look, follow it. They have postings on LinkedIn and Twitter and things like that. So with that, that's the end of the presentation that I have for you. Thank you very much for your attention. And I think we take questions later. Is that right, Louise?
That's it, Lynn. Thank you so much for sharing your thoughts and for this, well, in a way, challenging presentation. This concept of COVID fatigue. We have digital fatigue and then we have COVID fatigue. I'll make I'll keep some notes as well from your presentation to present them before the Q&A. But thank you so much for sharing your thoughts. We'll be together later on. Thank you so much. So it's time to move forward with our second speaker, Samantha Marsh, and I will just give the time to make a short presentation. Dr. Marsh is a public health researcher at the University of Auckland. Her research focuses on finding innovative approaches to addressing public health issues and communicating complex health information in ways that promote more equitable outcomes for all. Her research is broad, primarily focusing on areas where there are perceptions of risk or uncertainty, including vaccinations, social media news, and parenting. Samantha, thank you so much for taking the time. I know it's late over there in New Zealand, and I'm well looking forward to hear your thoughts. The floor is yours. Thank you.
Thank you very much, and thank you for having me tonight and inviting me along. So I'll just dive straight in because I don't have much time, and just apologies in advance. My internet might be a little bit, it may fall in and out. I've got a little bit of a storm here. But so basically, acceptance of vaccinations is a behavioural outcome which results from a complex decision-making process. And that process is influenced by a wide range of factors that we can broadly categorise into convenience, confidence, and complacency. And today I'm going to really be talking about vaccine complacency and how it relates specifically to the influenza vaccine in the context of COVID. So just a definition, which is, so vaccine complacency is when the perceived risks of vaccine preventable diseases are low and vaccination is no longer deemed a necessary preventive action. And it can be influenced by a number of things. So in situations where other life responsibilities are prioritised over the vaccine is one example. So if you are struggling to get food on the table for your family, then it is unlikely that getting a vaccine is really going to be a priority for you. And then we also have complacency influenced by the success of immunisation programs themselves and the impact in lowering disease prevalence and mortality. So in this respect, vaccines really become a victim of their own success. So it's a lot easier for us to refuse vaccines when we don't have a connection to the diseases that they're preventing. And so one example of this, I lecture a course on vaccine hesitancy to postgraduate public health students. And as an activity, I describe a disease, or I show a picture of that represents a disease, a vaccine preventable disease. And I get the students to guess what that disease is. And I always find it interesting that they almost never get diphtheria. So diphtheria, until quite recently, was a disease that killed up to 20% of children aged under 5 who got it. But it was known as kind of a death sentence for parents and was known as the children's plague. But we don't see it much in the developed world today. And so when we give our children the diphtheria vaccine, it's hard to understand what that is, and therefore people can become complacent about it. And so because of this balance between visibility and knowledge of the disease and the reality of a disease outbreak, vaccine complacency can also occur in a cycle. So on the next slide, this is a picture from a poster that was up in New Zealand in 2019. And I'm just going to use this as an example of when complacency can lead to disease outbreaks. So when this happens, so when you get a disease outbreak like we did in New Zealand, that can lead to increased perceptions of disease risk because the disease is now more visible and knowledge of the disease and the vaccine increases. And this can then result in decreased complacency and decreased vaccine hesitancy. However, over time, as the disease is no longer visible again, complacency can begin to creep in. So in New Zealand in 2019, we had an outbreak of measles. We had over 1,500 cases, and over a third of those cases ended up in hospital. And this was in part due to issues around confidence in the vaccine, particularly after the publication of Andrew Wakefield's paper, but also around complacency and lack of knowledge of the disease. So a lot of people just assumed that measles was a common, mild childhood illness. So they didn't understand the severity of the disease. And also there were a lot of people who had been vaccinated in the 70s who hadn't received their second dose of the vaccine. And so they thought they were fully vaccinated, but they weren't. And so in turn, we then saw an uptick in people getting the MMR vaccine. And then on the next slide, I'm going to just talk more about the influenza vaccine and complacency around that specifically. So for influenza in particular, vaccine complacency is quite high, and COVID may have further compounded this. So complacency to influenza vaccine can be determined broadly in these three subcategories. So first of all, I've got influenza risk here. So that's really about the perceived level of risk of contracting flu and the severity of the disease. The perceived risk might be particularly low at the moment as people haven't seen the flu much in the last year due to COVID. And then next is knowledge. So that's knowledge around both the vaccine and the disease. There may be issues around people being confused about whether you can get both the flu vaccine and COVID vaccine. And also some people believe that if they get the COVID vaccine, then that is giving them coverage or, for the flu vaccine, for the flu. And then vaccine prejudices, so side effects of the vaccine and effectiveness of the vaccine. So these also may have been brought to the forefront in people's minds, given so much misinformation circulating at the moment around COVID. So what might happen if complacency around the flu vaccine isn't adequately addressed? So on the next slide, I'm going to use New Zealand as a case study. So New Zealand might potentially have offered us the first example of variances resulting from the impact of COVID on relationships between humans and respiratory pathogens. So just some context. In March of last year, we went into a very strict lockdown to control COVID, but by June, we didn't have any active cases left in New Zealand. And so we went into what we call level 1, which is essentially life as normal, apart from the borders were closed. And so between June of last year and August of this year, there have only been brief periods of lockdown in New Zealand, and we've had very few restrictions. And as a result, last year, we saw large reductions in respiratory viruses, just like the rest of the world. So compared with annual averages, recent averages, these reductions for, I think, influenza was 99.9% and RSV was 98%. And the reductions were obviously for a variety of reasons. So we had closed borders, we were implementing social distancing, and we had increased hygiene measures. But what's interesting is what happened when some of these disease control measures were removed. So in April of this year, we had the Trans-Tasman bubble opened, which essentially allowed travel between Australia and New Zealand without having to go into quarantine. And after that, we saw an unprecedented increase in RSV. So according to our surveillance data, the hospitalisation rates for children aged 0 to 4 in the years leading up to COVID were 6.1 per 1,000. And 48% of these hospitalisations occurred in this preschool age group, occurred in the under 6-month-olds. And then this year, we saw some significant changes to these past trends. So including an increase in cases overall and a change in the age distribution. So for those children under 12 months, the rate of hospitalisation increased twofold. But in the older age group, which is the 1 to 4-year-olds, we saw a 5-fold increase. So why did this happen, and why might this be of concern for influenza? So on the next slide, I've got a picture from The Guardian. So this is talking about immunity debt. So first of all, it's not clear yet why we saw the RSV outbreak in New Zealand. We're just recovering from it and trying to figure out what happened. However, one plausible idea is that the lack of immune stimulation in 2020, particularly in young kids, resulted in what is being called an immunity debt. So this means that in New Zealand, we had a larger proportion of susceptible people and declined herd immunity to RSV. So we saw older children getting RSV and just a more general spread within the community. So this is one reason why there is concern about the impact of COVID on future influenza epidemics, and why it is so important to address complacency, given it is one of the major drivers of low uptake of the flu vaccine. Next, I just briefly want to cover some ideas around how best to communicate the importance of the flu vaccine with patients who might be complacent. And I want to start by discussing what we should perhaps be avoiding. So blaming and shaming. So when we cast people as enemies, they tend to shut down and stop listening. And that's not what we want. We want to keep lines of communication open. Next is that fear is not a great motivator. And in fact, it can have a bit of a backfire effect and actually increase opposition to the vaccine. And then we want to make sure that we emphasize collective action rather than focusing on the individual. Next, I've got telling other people's stories. So this is really about avoiding myth busting and negating. So this means we want to avoid saying things like, you may have heard such and such, or it isn't true. The more people hear something, the more familiar that messaging becomes. So we want to avoid reinforcing other people's negative narratives against the flu vaccine and instead stick to the story that we're trying to tell. And then finally, incentivizing. So this is often construed as a bribe. And if we need to bribe someone, then this implies there is something wrong with the vaccine. And we want people to find getting the vaccine inherently rewarding. And so therefore, we want to avoid the use of extrinsic rewards. So now on to the next slide, which is what we can do instead. In the good news department, vaccine complacency appears to be more amenable to information, but we still need to communicate effectively. So ideally, we want our communication to address the subcategories of flu vaccine complacency. So those are around perceived risk of the flu and the severity of the disease, knowledge of the vaccine, and vaccine prejudices. So now there are a number of ways to aid communication, and I've just chosen a couple to discuss here because we've only got a couple of minutes. So first of all, I want to talk about the use of metaphors. So metaphors can help us to explain a complex concept by associating it with a more familiar one. So if we go back to this idea of immunity debt, we could potentially use it to reduce complacency in the community. However, the idea of immunity debt is actually quite complex, and we don't usually have a lot of time in the vaccination setting to explain complex ideas. So one shortcut to explaining a complex concept is to use a metaphor that a lot of people are familiar with. So I'm going to give you an example of a metaphor that I just came up with earlier. I don't think it's a particularly great metaphor, but it just will give you an idea. But you want to select a metaphor that is relevant to your own community and something that most people will be familiar with. So I've just taken the metaphor of football. So our immune system is like a goalkeeper, and our friends, family, and wider community are our teammates, immune systems, and then the flu itself is the other team. Because of COVID, our immune systems are effectively out of practice and not performing as well as in the past. As a result, we will likely let more goals through this season. The influenza vaccine can act as a coach for our immune system. It trains our immune system to better fight the flu. And since we are part of a team, it is important that as many of our teammates get vaccinated also. This will strengthen the whole team and protect the weakest links from getting sick, in particular young children. So the benefits of using the metaphor of the vaccine as a trainer has been shown to help people understand that a vaccine does not stay in the body after it has effectively trained the immune system. And it helps people to understand that it isn't the vaccine that fights the flu, but actually our own immune system. And also it's unlikely to trigger concerns about long-term or permanent side effects. Using the metaphor of the team also can help explain the need for collective action. So it's not just about the individual. And finally, that can also help address the issue around the effectiveness of the vaccine because it points to the importance of everyone around you needing to be vaccinated. So metaphors are really useful and powerful shortcuts to instant and memorable understanding of a concept. And you can really use them to evoke vivid images and allow people to see things from a new perspective. And then another option is to use storytelling. So stories help people assimilate new and conflicting information into their current belief systems. So New Zealand could act as a warning of what could happen to other countries. While we had strict lockdowns, our lockdowns didn't really last very long. And for most of the last 2 years, we've been living in relative freedom here until recently. However, we've already had 2 significant outbreaks. So as I discussed earlier, we had RSV earlier this year, but also at the end of last year, we had a norovirus outbreak. And then finally, although I haven't put this on this slide, another thing we can do is to surface particular values to motivate change. So this year, I was dropping my kids off to school and I was talking to some of the parents about how sick all of our kids have been this year. And one parent made the comment that they felt that their kids' immune systems were overwhelmed and needed a break to recover. And so far, our experience in New Zealand has been that the kids have been hardest hit by the long-term impacts of disease-containing restrictions due to COVID. So for this reason, messaging around the flu vaccine might need to focus on kind of surfacing values of benevolence. So in particular, ideas around mature love or maternal love to motivate people to change their behavior around the flu vaccine for the sake of protecting children. So that was just a very brief overview of why we need to be extra vigilant of addressing flu vaccine complacency in the context of COVID, and some general ideas that I put together, which will hopefully help with communicating with your patients. Thank you.
Thank you so much, Samantha, for your presentation. Some practical tips for those who actually need to communicate with populations or with patients. I took a lot of notes, by the way, so really, really handy. Thank you so much for your time. I'll make a wrap up at the end of all presentations before you go through the Q&A. And then we move forward. We are next speaker, Dermot Thomley. Dermot was appointed president of the Irish Pharmacy Unit in June of this year, and he has previously served as a vice president of the same organization from October 2020 until this appointment as his president. Dermot qualified as a pharmacist for the University of Strathclyde in Glasgow in 1995. He has been running Cloyne Pharmacy in East Cork since 1997. So you have here a practitioner, a community pharmacist who has been practicing for many years. Prior to becoming president of IPU, he served in numerous committees in the organization. Dermot, thank you so much for your time and congratulations on your elections. The floor is yours. Thank you.
Thank you, Louise, and good afternoon, good morning, good evening to everyone. Some really good presentations, and like yourself, Louise, I have lots of notes from them. So well done to Lynn and to Samantha. So I'm just going to give you a bit of context in terms of the Irish situation, in terms of influenza for the coming season, and also our experience in the past, and also with regard to COVID vaccination. So the next slide, please. Thanks. So Ireland, as you probably know, population of just under 5 million. We've 1,905 community pharmacies, and the majority are pharmacist owned and operated. There are a number of chains as well, like Lloyd's, Boots and Allcare, and some symbol groups. And there's no restrictions on pharmacy ownership or establishment. So just to give you a bit of background really in terms of the vaccination timeline, I suppose if we go back to 2008, looking at the strategic future for pharmacy services, it was mooted to look at vaccination through community pharmacy. And 2009, and it was interesting, Claire from the IPO was helping me with the slides here. She was saying that we were all trained, I think 1,400 pharmacists, to administer the H1N1 vaccine in 2009, and we weren't required. I'd actually forgotten about that training, so it's amazing. You know, if you don't use something in the past, you often tend to forget about it. But certainly legislation came on the following year, and in 2011, pharmacists were allowed to administer the influenza vaccine. And we started with small numbers, but as the years went by, then there were other things added in, such as 2015, we can administer the pneumococcal or the shingles vaccines. Now, admittedly, these are private service, not paid for by the state, so they haven't really taken off. But at the same time, it's been helpful that pharmacists have been able to administer those. In 2020, then, with the pandemic, two things happened. Pharmacists are allowed to administer vaccination outside the pharmacy premises, and also the LAIV children's nasal vaccine was available for community pharmacy to vaccinate during the influenza season. And then in the past year, with regard to COVID vaccination, pharmacists were allowed to administer it. Admittedly, we were late to the cycle. It was really late June before we actually got onto the pitch for this, but it's important that pharmacists have played their role. And also legislation was changed to allow pharmacy students to vaccinate in the community vaccination centres. So in Ireland, during COVID, we had GPs or doctors vaccinating, we had vaccination centres, and we had community pharmacies. So the next slide, thank you. So this slide is quite interesting in that it talks about the influenza vaccine rates in Ireland from the period 2008 to 2020. And I suppose the key point really is that in the centre of the slide, the winter of 2011-2012 was when pharmacy started vaccinating. And as you can see, as years went on from 2011-2012 right up to 2020-21, you can see that the green on those bar charts are the pharmacies that have been vaccinating, starting small and increasing significantly as the years have gone by. And certainly last winter, over 300,000 vaccines from influenza were administered at true community pharmacy. And this represented almost a quarter, or 25% of all flu vaccinations in primary care. And what was interesting is that there was 1,200 pharmacies delivered the vaccination service last season. And this coming season, we're looking at 1,600 pharmacies out of 1,905. So approximately 85% of all pharmacies are and will be involved in the vaccination program this winter. So it's really got buy-in. It certainly started slow, but as you can see with the graph, year on year, pharmacies are increasingly playing their role in this vaccination program. So just to maybe step back a little bit and look at the COVID vaccination program as it pertained to community pharmacy, there were approximately 1,000 pharmacies involved. Again, approximately 50% of the number of pharmacies in the country. And again, over 310,000 vaccines administered to date. The vaccines that community pharmacy in Ireland were using were the Janssen and the Comirnaty vaccines. They were the two. What was interesting, I suppose, is that when we came onto the pitch, as you can see in the graph at the bottom, which was kind of mid to late June, the only cohort that we were able to vaccinate initially were the Janssen cohort of over 50-year-olds. And these were all patients who could have got vaccinated in mass vaccination centres, but for various reasons, either they missed their appointment, they weren't able to travel, couldn't attend, or whatever, didn't. And certainly the evidence was that excuse me, that community pharmacy did well in terms of picking up people locally in their communities who, for whatever reason, didn't attend the vaccination centre. But what happened subsequently then is the Janssen cohort was licensed for a much larger cohort, and then they presented themselves in community pharmacy. And then subsequent to that, the Pfizer vaccine became available in community pharmacy. So as I say, we were quite late to the COVID vaccination programme. But once we did get involved, our numbers were quite significant and staggering. And we've shown that we've really had a role to play in this program. So just some examples there of, with regard to, I suppose, human stories in the Janssen over 50 program. And again, it was highlighting, I suppose, the accessibility of pharmacy. So the one lady was vaccine hesitant. She wasn't going to get the vaccine, doesn't like taking medication in general. But when she found out she could get it through the pharmacy, it didn't to her sound as daunting a prospect. She knew the pharmacist, she went in and she was happy to have a discussion and to get the vaccine through her local pharmacy. The second one was a husband and wife. They were technically challenged. They were waiting for a call from their GP or their doctor that never arrived. And then they were saying that they were thrilled that they were able to pop into the pharmacy and to get the vaccine completed there. And the third one then is a Brazilian worker with no predictable hours off, presented and was vaccinated within an hour, and then 4 of their friends followed suit. And these would have been people that all would have been vaccine hesitant. And I suppose if we talk about Ireland, we have 50% of the population living in close proximity within a few kilometres from their pharmacy. and 85% of the population live within 5 kilometers of their pharmacy. So the accessibility is key to the vaccination program. So the next slide, thank you. This graph actually follows on from Lynn's graph that you showed earlier. And again, it feeds into what both Lynn and Samantha have said, which is that I suppose the past season, particularly in the Northern Hemisphere, there was no appreciable flu. And I suppose because of the social distancing, because of wearing masks indoors, because of hygiene, that was the result of the last season. But there is obviously concern about this coming season, and there may be a reduction in immunity and increased susceptibility to the flu, as the other two speakers have said. So it may be very, very significant that vaccination for influenza happens this coming season because of that. And as Samantha mentioned, because of the drop in immunity that has been seen, because of the low level of exposure to bugs and to pathogens. So just in Ireland, the 3 vaccines that we're administering this season, just to give a bit of context, the first one is a Fluad Tetra. That's an AQIV vaccine, and that's licensed in Ireland for people aged 65 and over, and it's intramuscular injection. The second one is the QIV, and that's by Sanofi Pasteur. And this particular one, again by intramuscular injection, is really for the cohort from 18 to 64 or 65 years old. So it's for the majority of the population. And the third one then is the LAIV, or the intranasal vaccine, and that's licensed for children from the age of 2 to 17 years old. In terms of the past season, I suppose a lot of the LAIV vaccines were administered through community pharmacy, and it looks like that would be the case again due to our accessibility, and also with the October half-term break coming up, a lot of families and children will be off. They won't be in school, and they'll be, I suppose, available to get the vaccination. The other thing that's interesting, again, and just to complement the earlier speakers, is that in Ireland, the vaccine is reimbursed for at-risk groups. So all children are covered with a free vaccine, and also all those age 65 and over will be paid for by the state. People in between sort of 18 and 64, 65, they will be covered and have their vaccine reimbursed if they are in an at-risk group. So certainly that ties in nicely with what is the experience in some of the other countries. Here's an example of just some algorithms and leaflets and posters that have been put together by the HSE, the Health Service in Ireland, as to why people need the vaccine, and information on the different vaccines. In terms of the COVID vaccination, currently we're looking at fully vaccinated population of 87, 88%. So vaccination has been, I suppose, a very positive experience in Ireland, and hopefully that will follow through into the flu vaccination program. Thank you. So the IPU, the Irish Pharmacy Union, has a lot of supports for pharmacists for the upcoming program. And these are as follows. There's a frequently asked questions document on our website. We have consent forms for our members, SOPs and policies, information on the vaccines, guidance documents, and these are regularly updated by Claire and the team. We also look at the legislation, and there's been webinars to train people and to explain the potential pitfalls and how to run a professional service. There's been promotional material, support material, and training links, and as well as helping people with regard to an appointment booking system as well. So it's been very comprehensive, the support from the IPU for pharmacy members, and I think it's been well appreciated. These are some of the posters and the JPEGs and the GIFs that are available in terms of people can use for their social media for vaccination this winter. Certainly my experience on the ground is that we've certainly contacted people who would have used our program in the past, who would have got vaccination in the pharmacy. We're finding that we're getting more phone calls now than we would have had in the past. And really it's a scenario of trying to manage, I suppose, our workflow and to get to those that need it the most in the timely manner that Samantha mentioned in her previous talk. Thank you. So to summarize, really, I suppose Irish pharmacies are involved in the national programme, and it's very, very important both from an awareness point of view, from an access and an uptake point of view. Community pharmacy is available, opens reasonably long hours, and has been involved in the programme for 10 years and increasingly involved in other elements of vaccination. The total number of vaccines in Ireland is increasing since pharmacists started vaccinating, and patients want access to healthcare at a time and a place that suits them from a trusted healthcare professional. And the graph on the left-hand side is probably not very clear, but it shows for the first time that community pharmacists in Ireland are seen as the most trusted healthcare professional. It's the first time we've actually surpassed nurses in this whole. So certainly the patients and the public, they are very much in favour of pharmacists expanding their role, in particular in the area of vaccination. And patient satisfaction with the service is indeed very high. So that is it. So thank you very much.
Thank you so much, Dermot, for sharing the experience of Ireland regarding vaccination, flu vaccination, some landmarks. Also to thank you for sharing the resources that you prepared for community pharmacists, and also the massive effect on COVID vaccination performed by community pharmacists. That's really is good to know. I just would like to emphasize that due to the COVID pandemic, the number of countries worldwide who have been allowing community pharmacists to vaccinate is increasing, which is very good. So it's good to know that we've also been requested to be involved in vaccination on COVID-19. So thank you for that. And now move forward to our last participant, or to last speaker, Danielle Pais. Danielle, she holds a Bachelor and Doctor of Pharmacy degree from the University of Waterloo and a Bachelor of Science in Applied Pharmaceutical Chemistry from the University of Guelph. As Chief Pharmacist Officer at the Canadian Pharmacists Association, she actually was involved or become the Chief Pharmacist of CHPA because of her clinical role as a hospital pharmacist in Toronto, with previous experience in community pharmacy industry and academia, and brings a unique pan-Canadian view into the needs and perspectives of pharmacists across Canada. Well, Danielle has been struggling with the time as well, because she had to wake up really, really early in Canada. Thank you for that. She had a challenging night with her daughter. So, well, thank you, Danielle, for your time and for your resilience, which is actually an hashtag that is very common nowadays. And we are very much looking forward to hear what you have to share with us. So the floor is yours.
Thank you very much. Yes, I have a teething infant, but we're all good. So good morning from Canada. It's an absolute pleasure to be here. I will start off the presentation by acknowledging that I am speaking to you from the traditional territories of the Indigenous peoples of Canada, and we acknowledge and appreciate their history and their stewardship of the land. So I'll begin my presentation. If we could advance the slide. We'll go a little bit further than that to show you that, if we could advance the slide one more, to give you a little bit of context behind Canada and where we are in terms of, just the pharmacist role. So Canada has about 38 million people. We're divided into 10 provinces and 3 territories. Our healthcare model is publicly funded. That being said, each province has their own say in the jurisdiction of the way public funds are divided up and how healthcare is delivered. I'm going to take an opportunity to play a quick video just to summarize a little bit about pharmacy in Canada. Perfect. Thank you. So that was just to give you a little bit of insight into what the pharmacy landscape is in Canada. We'll move on to the next slide. So as I mentioned, the pharmacy scope in Canada is varied. So depending on the jurisdiction you live in, pharmacists will have different authorities to engage in healthcare. So I've highlighted here the good news is that when it comes to vaccinations, the majority, 85% of jurisdictions in Canada do allow pharmacists to participate. And so you can see here, as a country, we're advancing. This chart of scope continues to evolve, and we're hoping to make it all blue check marks one day, but I just wanted to give you a little bit of background. We'll advance the slide. So when it comes to immunizations, pharmacists have been vaccinating since 2007, and that's about 14 years of giving flu shots, which is great. To be authorized to give injections in Canada, you do need to go through special training. This training has become standard in the PharmD curriculum across the country, and so it's part of how we're being trained and training our future pharmacists. In addition to having your first aid certification and liability insurance to include immunizations, most pharmacists all pharmacists that are injection trained can be identified through the regulatory websites. The beauty of including pharmacists in the picture is that we are starting to see that people are really gravitating towards their pharmacies as their destination. And so Canadian pharmacists are playing a vital role in public health. Over half of the influenza shots that are given across the country happen in pharmacies. Advance the slide. So now I want to share with you some really cool data. The Canadian Pharmacists Association commissioned a national survey. We'll advance the slide, and just ahead of flu season to give us insight into what Canadians are thinking coming up to flu season. So if we advance the slide, we can see that 56% of Canadians plan on getting their flu shot this year. That is actually up from last year. We're also noticing that most Canadians are actually more inclined to get the flu vaccine because of the COVID pandemic. So we're seeing a positive impact of that fourth wave and the pandemic setting on influenza vaccinations, which is really encouraging. Again, as I mentioned, pharmacies are the preferred destination, and they're the top choice. And I think that has a lot to do with the convenience and the accessibility. We know that because the demand of flu season is going to be high, pharmacists really do need to be equipped and ready with the flu shot so that we can reach as many Canadians where they're at. So when we talk about accessibility, we talk about convenience and flexibility. You know, pharmacies are really well positioned. We've got the infrastructure, we've got temperature monitored fridges and controlled environments. So, you know, breaking the cold chain is not an issue. We are ready set up to manage vaccines and storing them. So administering them on site makes sense. As mentioned in previous presentations, people trust their pharmacists. There are established relationships there. There's a lot of good that happens at the pharmacy. And because of that relationship with their patients, pharmacists are trusted and they're well positioned to be able to deliver this added value and this added service to their communities. What's interesting is that in our survey, we found that 93% of people who received their vaccine at a pharmacy last year are likely to return to the pharmacy this year. So that's a really high success rate. I mean, people are satisfied. They like going to their pharmacy. It's easy and convenient. The other added benefits on the overall healthcare system is that pharmacists, having vaccines in pharmacies reduces the time, or helps save time in physician offices, and it also reduces emergency room visits, which have associated healthcare costs to them. So that's a big savings for the system. One of the advantages of pharmacies is that they do offer so many different ways to get your vaccine. So the vaccine program is delivered differently depending on the pharmacy. Most pharmacists offer extended hours. Some of them have dedicated times for vulnerable populations. We have pharmacists that are able to do home visits, which is wonderful. We can meet some of our isolated patients or vulnerable patients at their home so they don't have to come out. We offer off-site clinics, so going to community centers or retirement homes and setting up in the lobby or in a common area. So just making it easier for people to access the vaccine. Drive-throughs are another option. As the video mentioned, most Canadians live within 5 kilometers of a pharmacy. So that's really great. What we did find out is that the two most important factors when a patient is deciding whether or not to go or where to get their flu shot is the convenience of or the ease of booking their appointment. So most pharmacies nowadays are using online booking tools, allowing patients to access their appointments through their phones. And for those populations or demographics that don't necessarily have a smartphone or access to technology, calling your pharmacist is always an option. You know, we have a lot of seniors that love to come in to visit the pharmacy. So being able to be close to your community, having services available that they're already coming to see you for when they pick up a prescription or when they're coming in to have a medication review, those are really key times where we can leverage the easy access. Continue. So as an association, we are an advocacy body for the profession. We work with the Public Agency of Canada. We sit on our National Advisory Committee on Immunizations. This is the body that makes recommendations, and we are able to provide the pharmacist perspective. And by gathering that information, we can then disseminate it and help equip our frontline pharmacists with the knowledge that they need to answer questions and make recommendations. And we create resources and shared experiences and build on what we learn. We're all in this together. I've seen that's the theme. You know, we're exploring new territories. Every season seems to be a new context. So learning together and collaborating with other provincial associations and sharing lessons learned has been a really big help. Continue on. Advance the slide. So specifically talking about COVID in the context of influenza season, many Canadians are already vaccinated with COVID-19. So we're up to, this was taken in September, so it's probably up above 80 now, but 80% of Canadians have the COVID-19 vaccine. And so with that, comes along with the decreased restrictions. We're not necessarily in as stringent of a lockdown environment as we were, more socialization, more increased risk of spread. It's just the nature of the times that we're in now. So with that, I will say it's really interesting and really reassuring to know that overall, the pandemic has positively influenced Canadians' desire to get the flu shot. It's still, we're not as high as some other countries, but you know, we're seeing a trend upward. So every year, more and more Canadians are getting their flu shot. Continue. So promoting easy and convenient access to pharmacies. Most promotion happens on the independent level. So pharmacies are privately owned. We do have chains and large corporations. A lot of the promotions take place at the pharmacy level. So whether or not that's store signage, you know, window decals in the entrance, things like that. That's part of the appeal of going to your pharmacist is understanding what they can offer. The other piece that I wanted to mention is that pharmacists are, again, really well positioned to identify those vulnerable patient groups. So making sure that they proactively reach out. You know, a lot of pharmacists do medication reviews. They know their communities, they know their patients, and they're easily able to identify the most vulnerable in our population. And so making those phone calls, connecting with the people that need it the most is a very natural thing for pharmacists to do. And it's easy for them to do it because they have the information in front of them. Pharmacists as educators, that's a really big one. There's a lot of misinformation out there, and pharmacists pride themselves in being a source of reliable evidence-based information. And so helping to promote those messages, to instill confidence in your patients, it comes with the role. We'll continue. The other piece is the robust supply. So last year, we actually were in a situation where we didn't have enough vaccine, so that influenced vaccination rates. This year, we're very excited because there will be multiple vaccines available on the Canadian market. And so pharmacists are going to have enough supplies to meet the demand. So we'll likely see, and I'm predicting that we'll see an increased number of vaccinations because we now have the ability to meet the demand that's existing. With multiple vaccines, they're, navigating who gets what. That's some of the conversation that needs to take place. But it's really exciting that we are able to have those conversations this year. We'll move forward. Co-administration. So Canada is one of the countries that is promoting and recommending COVID-19 vaccinations along with their flu shot. It makes sense just from a convenience standpoint. You've got a patient in the seat. They've come specifically for a vaccine. Why not take advantage of the opportunity to give them their influenza shot as well? We've got the group of people that are getting their second dose of COVID-19 vaccine, the third dose for the immunocompromised and seniors that are living in congregate settings. And then the latest one is vaccines for children. That's still pending approval in Canada, but it's looking like we're going to get to the opportunity to get more and more patients in front of us. And so we really want to take advantage of that opportunity and get them immunized for the flu vaccine as well. The other point I want to mention, and this is something we can't ignore, is that healthcare workers are tired, they're fatigued. We're hearing a lot from our frontline about burnouts. And so protecting the psychological wellness and mental health of our frontline pharmacists is something that's top of mind for us. And we're already starting to engage in conversations with other associations, so the Canadian Medical Association, the Canadian Nursing Association, to figure out what we can do to support our frontline healthcare workers as we go into flu season, because they've been doing this for 18 months, and it's it requires a lot of mental and physical energy. So that's something that we're considering. Move forward. The other piece I'll just end off with is some of our best practice resources. So one of there's different areas we approach this. We approach this through the lens of operational excellence and making sure pharmacies are equipped for success. We talk about patients, making sure that patients know what to do and that they're prepared, and then helping to give pharmacists the resources through frequently asked questions. I see a lot of similarities with what's happening or the resources that are being provided from Ireland. So it's really nice to see that we're all involved in helping to get that good, reliable information out there. If you advance the slide, I'll show you an example. So this is our guidance on managing pharmacy operations. Running a flu clinic within a pharmacy within the context of a pandemic requires a lot of thought, and there's so many different areas that you need to focus on. So this is our best practice guide. These are just the categories that are addressed, but personal protective equipment, documentation and forms. It's really, really important that we have workflows and address documenting the interactions and the healthcare services that you are offering at your pharmacy. Screening for COVID. If you advance the slide, you'll see we have a fact sheet for patients so that patients are able to participate. It's not just the pharmacy and the pharmacists and the pharmacy technicians. it's all of us together. So making sure your patients are equipped so that they know to screen themselves, so they're not in front of you when you determine that they are not eligible for a flu shot. So working ahead, making sure you can make an appointment ahead of time, wherever you can save time and add some clarity. When you know how many patients are coming to your pharmacy ahead of time, it just helps you manage your day and your workload. If you move forward, this is again a tool that was designed so that we can advise patients on what to do. You know, showing up on time, not too early, managing the number of people in your pharmacy, wearing a mask. These are common practices, not just in healthcare settings, but you know, in restaurants and social settings. But it's an important reminder, and it addresses that idea of complacency. We want to make sure that infection controls are in place. And then this is just a snippet from our frequently asked questions, just so that pharmacists have an idea of how to address these concerns when their patients come to them with flu-related questions. The other thing I mentioned, and I want to mention, is that this year, pharmacy technicians were granted authorization to give COVID-19 vaccines. It's not the case for flu, but helping to expand the scope of our technician colleagues actually offload some of that work from the pharmacists so that they can focus their attention on influenza vaccine. So all of that to say, we're really excited this year. There's a lot of hope that we'll be able to increase our numbers. And yeah, thank you very much for giving me the opportunity to present.
Thank you so much, Danielle. And with your presentation, we finished the presentation part of our webinar, and now we will move forward to the Q&A part. But first, I would like to thank the enthusiasm and the availability of all the speakers to share their expertise and information. It's very important just to be able to share what you have lived and what you work on to colleagues worldwide. I'll just make a short wrap-up of what has been discussed in the 4 presentations. We start with Lynn, who shared some perspectives from the IFDMA, and the fact there is an influenza vaccine supplier who has been working within the organization with WHO, checking the strains evolution, and also working on policy, practice, and communication. There's been some work done with PGU as well, the pharmaceutical group of the European Union, and Lynn shared some interesting facts. Like last year, it's just in USA, there were reported 2,000 flu cases in the US, while in the previous year it was 35 million. So you can actually have here the idea and the perspective of what was changed last year when compared with previous year, and what might happen in this year into 2021. We talk about the lower population immunity due to the low circulation and biomeasures of COVID-19. That was actually mentioned as well by the other speakers, and this idea of might be some complacency to not get the vaccine. And yeah, so roughly was this. It was very important just to focus that there needs to be an involvement of healthcare professionals in order just to cope with what might happen this year. Then we move to Samantha. She shared with us some perspectives, some scientific perspectives regarding vaccines complacency. She spoke about the influence of the perspective of influenza risk, the knowledge about the disease as well, because if you don't go through the effects of a disease, you might just to feel more complacent not to get vaccinated, and also about the vaccines prejudice. We had a very practical impact, practical ideas or I would say it, tools or skills just to work on when you deal with patients, and some strategies which is really interesting, and also some staggering facts from New Zealand regarding some diseases in children and the impact that they had on healthcare system. And then we move forward with Dermot, who started to focus on more practical issues regarding vaccination. So when you go for the strategy, you need to understand what's going on. We focus that from the conceptual point of view, and I move forward with the impact or the influence of community pharmacies, first with Ireland and then with Canada. Then we had an overview of the involvement of pharmacists in flu vaccination in Ireland, also the influenza program for 21-22, some reasons and some facts that can be used by some of our colleagues that unfortunately work in jurisdictions where they can actually vaccinate, and then also share some examples from the COVID vaccination and the success it was and is still being in Ireland. Then it finished with Danielle with a lot of enthusiasm, which is great, about pharmacy perfection. I also share that enthusiasm, and while she also worked in many settings, what is very good to have her perspective. First of all, to have an overview of the pharmacy scope of practice in Canada. As Danielle has mentioned, we have a country with different territories and different provinces, and then the scope of practice changes. But it's interesting to see that the vaccination is almost widespread through all territories, which means that there's actually an effect, and the governments just see the impact of immunization in pharmacies. Then you move through a lot of strategies, a lot of information regarding patient education, about the practice resources that they've been given also to community pharmacists, and the guidance, for instance, on managing pharmacy operation, the workflows, the documents, the premises preparations. There's actually a lot of information that our colleagues, if they haven't been able to take some notes to their presentation, can actually go through later on, or checking the records. And then if you want to move forward to get prepared for the flu vaccination. We had some comments, many hellos from worldwide. So thank you so much. And thank you as well for your positive feedback. We had a couple of questions also on our Q&A, but then we have someone actually get out of the scope of this webinar. There is one actually here that Lina's already mentioned that she will answer live, that if concomitant administration, how can any adverse events be attributed? So Lynn, can you just send some words about this?
Sure, it was actually a mistake. I was trying to type it and pressed on the wrong button, but anyway. So
happens.
I'm not a physician, but if you think about the way the studies are run, they have, these are controlled trials often, and I know that from our own company actually ran a concomitant study. It's not been published yet, unlike the UK one, where you have one arm of the study which has both vaccines. Another arm will have vaccine 1, another arm will have vaccine 2. So then you can compare the reactogenicity and tolerability that you're seeing of with the vaccines given on their own versus the co-administration arm. And that's usually how you would conclude on the safety on one hand, and also any impact on the immunogenicity, either for flu or for the COVID vaccine. But I'm happy to share that the ComFlu-Cov, I do get that one mixed up, publication. If it helps, you can put that in the chat if people want to go and have a look. But that's normally how the safety would be measured in those kind of controlled trials.
Okay, thank you so much. I would just like to emphasize that there's been some questions regarding COVID vaccination on the Q&A. And as I mentioned, this is not actually the scope of our presentation. However, our staff will just take some notes, and then we'll be working on the topics on other webinars. I would like to address some questions that have been put here for Samantha regarding communication skills. So from what you have experienced or what you work on a daily basis, you mentioned specifically what to do on flu vaccinations. However, we had a couple of community pharmacies who are actually addressed through emails. Well, sometimes you get questions through emails regarding what sort of resources are available to healthcare professionals to evolve their communication skills, because we all mentioned that it's important. And of course that somebody came here just with the idea of giving some feedback regarding the flu vaccination, but what other resources can they sought for? What can they do to improve their communication skills since they're dealing with other healthcare issues?
So there are websites that they're companies that have, or research group, private companies that have come up with resources that, so they have reports, in-depth reports of the research they've done on how to communicate, but also then cheat sheets and things like that that can really highlight the way to effectively communicate. And they kind of show what we tend to do and why it doesn't work and what we can do to improve our communication. So I can have a little flick through here. I can send you through a couple of sites that I frequently use, but they're based on research. So they do the research and then they provide reports on how best to communicate, and vaccines in particular is a big one currently.
Thank you so much. So the staff will just take this information later on, and thank you for your availability. You can actually send out more resources to all our participants. And there's also been a question here regarding services provided in Ireland and Canada regarding vaccinations. Are those services paid? Some questions some of our colleagues are asking. Dermot?
Yeah, sure. So in terms of the flu vaccination service for the at-risk groups, so the very young, the very old, and those in between that have at-risk conditions are paid for by the state. But members of the public who don't fit that criteria can elect to get a vaccine privately, and then the pharmacy will charge the patient for the vaccine and for the service. So last winter was interesting in that all household contacts were allowed to be covered under the state scheme, whereas there's a difference this year. Just because you're a household contact doesn't mean you get the vaccine paid for by the state. You have to fit into one of the criteria as set out.
Okay, thank you so much, Danielle.
In Canada, we're very lucky. All the vaccines, the flu vaccine is covered for everyone. So it's not a barrier at all, regardless of your status or your age. You can go in. What may change, however, is which vaccine you're eligible for. So the eligibility may be a little bit different. Certain high dose vaccines, for example, may be reserved for the more vulnerable population. The other thing I will mention, just for interest's sake, compensation remuneration is different in every province as well. And so in some jurisdictions, pharmacists will get a higher fee or revenue for that service.
Okay, thank you so much. Well, time flies and I'm just running. Well, sorry, Lynn? Would like sorry.
I wanted to make a comment just before we close. I loved Samantha's metaphor about the football team.
Yes.
I was kind of writing it down.
Sorry, Lynn. Well, really, shame on me. I didn't mention
really
that. Shame on me. Yeah, very, very good. I don't know what Samantha mentioned that is not a good one. I think it's excellent. I'm looking forward to see the good ones according to Samantha's evaluation. That's why. Yeah, the football is amazing. I think I'll use that one with my patients. Definitely.
I don't know much about football. I've just been watching Ted Lasso, and it just was in my head, and I was thinking about a way to explain it, and that's what came into my head.
Yes.
Really, it needs a cartoon, actually.
Definitely.
Yeah.
I'll just put some creatives working on that. Definitely. And I was mentioning, well, time flies, and 1 hour and a half flies really, really fast. The presentations are very comprehensive. So there has been that many questions, which is good. Means that people have been clarified. I would like to thank on behalf of FIP, all the speakers, all participation, and also thank you to our staff, our secretariat staff, who has been very quiet. They don't show up, but they make all this magic to happen. So I'd like to thank you again for your participation. And I'd like to also emphasize that FIP continues its quest to provide webinars and informative sessions to our members. Please stay tuned with our social media accounts and also on the FIP website, that there'll be other presentations for you. Again, thank you so much for all the speakers and all the participants. I'm very much looking forward for another opportunity.